I am Dr. MUKESH at Manek Skin Clinic, Kalyan. We are about to do ear lobe surgery. You can see the defect here, right ear pin. The procedure is easy, simple, but it has to be done in a full aseptic precautions. As you can see here, now we are cleaning the part with betadine and then spirit. Giving the ear block. This is a mixture of lignocaine plain with bupivacaine. Total is 1 ml. So 30 gauge needle at the junction of ear pinna and removing the edges or removing this epithelial margin. It's a double defect. There were two defects side by side. So now we are taking simple interrupted sutures 3-0-ethylone on the front edge. So we can see it's been nicely taken care of. Show the front side. Yeah.